All right. Welcome, everyone. We will be starting shortly. Thank you for being here for our latest Dream Talk. All right, so I think we are all settled and we are recording. So I will go ahead and get started. I am Caroline Sorelli. I am a research coordinator with the Johns Hopkins Disability Health Research Center, and I am so excited that we are able to support the Docs with Disabilities Initiative Dream Series. So we are back here again with another exciting talk with Dr. Alison Callwood, and I am thrilled to welcome her and discuss her exciting research today. So Dr. Callwood is an associate professor at the University of Surrey, and she has gained her Doctor of Philosophy in 2015 at that university. She has a background in midwifery, nursing practice, and education spanning 30 years. In 2023, she was awarded the highest accolade from the Royal College of Midwives, a fellowship recognizing her extensive work in building fairness into selection to health professions. She's also a internationally recognized structured interview specialist, actively engaged in postdoctoral research, exploring admission to health profession education programs. She is a fellow of the Institute of People-Centered AI, University of Surrey, the UK Medical School Council MMI Expert Group, and Council of Deans for Health EDI Reference Group. Alison has been awarded multiple grants from Innovate UK, the United Kingdom Innovation Agency, including the 2023 Women in Innovation Award. She is now the founder of a tech for good recruitment startup company, Sammi-Select, having co-designed and built Sammi, the first known online multiple mini interview platform with principles for fairness built in. Her recent work includes the Genius Generating Neurodiverse Inclusive Selection Project, exploring the impact AI can bring to recruitment and admission and how the interface between technology and humans can be softened to facilitate equity, inclusion, and diversity, particularly for neurodiverse applicants. So you can see why she is a wonderful fit for today, and she will be talking a bit with us about the responsibility to ensure fair selection in our health professions workforce. So I'm thrilled to introduce her. Alison, please. One last thing, sorry. You may notice Amy Druick is our American Sign Language interpreter today, and Rachel is our closed captioner for today. If you have any accessibility requests, please feel free to let me know, and we will get that all sorted. And now, without any further ado, I'd love to introduce Dr. Callwood.
Thank you. Thank you. Can you hear me all right, Caroline? Are we good? Yes.
Yes.
Hi, lovely to meet everybody. Thank you so much for having me to present this afternoon. I feel like that was a long introduction. Sorry about that. But what I'm going to do, I've got some slides which I'll share, and then I will talk, and then hopefully we've got time for some questions afterwards. So if I share my slides. Okay, just 2 seconds, sorry, not sure. Okay, can you see that okay? We good?
Yeah. That's great.
Lovely. Okay, so the title of this talk is Innovating for a Sustainable Workforce.
Oh, actually, sorry. I apologize for jumping in. It's not full screen for us. I don't know if you want to, the present button should be at the bottom right.
Okay, so I've got full screen. That's strange.
Hmm.
Let me just check. Is that better?
Yes, thank you.
Are we good?
Perfect. Yes.
Okay, brilliant. Great. So the title of this talk is Innovating for a Sustainable Workforce through Neuro-inclusive Selection to Health Professions. And what I'd like to do is just do a little bit of a background and a brief introduction. I'm going to give you an overview of the work that I've been doing on some technology called Sammi, which I'll tell you about, and some evaluation data. And then the Genius project, which is generating neuro-inclusive selection, and some results from the evaluations that we did there, and then some take-home messages, and then hopefully we'll have time for some questions afterwards. So looking at background, I just thought it'd be good to introduce myself. I'm from the UK, as you probably gathered. I live on the South Coast. I've spent 30 years in healthcare. Basically, I started out wanting to be a nurse and a midwife, and that's me a long time ago, looking much younger as a midwife. But this is really important because it gives context to the journey that I've been on, which is very unusual. And I worked as a midwife in Africa. I worked in Malawi. And so my whole kind of motivation, if you like, passion about fairness really started at an early age. And I've been really vested in how we can bring fairness into so many aspects of our work, but most recently that our workforce represents the community that it's serving. So I spent 3 years working out in the middle of nowhere. And I also this is showing my age, but I also volunteered for Mother Teresa. And again, so working in Calcutta, you could see the destitute and the problems there. And I wanted to build that fairness in. So what did I do? So this is me doing a bungee jump off a Victoria Falls Road Bridge in Zimbabwe. And that's what it felt like. So I had a lovely safe bubble. I'd been a nurse and a midwife, but I hurt my back. So I couldn't carry on working in clinical practice. And I had to do the next best thing, which was in my eyes, was to train student midwives. But then I got really into recruitment and I realized that it wasn't always fair. And so I took this kind of leap of faith, and that's what it felt like, doing that bungee jump, to set up a company to see if we could do better with how we select to our health professions. And I've won various awards. The one on the right is Vice Chancellor's Award. And I've got a PhD in multiple mini interviews. I don't know how many of you on the call are familiar with those, but we're going to touch on those in a minute as a way of recruiting. I've worked for the United Nations Secretariat in New York as an international structured interview specialist. And I've been awarded a number of grants from Innovate UK, which has enabled me to do the research that I've done. So that's a bit about my background. So we set up this company called Sammi-Select. And Sammi stands for Scalable, Automated, Multiple Mini Interview. And as I mentioned, MMIs, I'm going to talk about those in a minute, but our whole kind of ethos is to help large organizations unlock applicant potential to achieve a diverse workforce, particularly in underrepresented groups like the neurodivergent community. I'm just going to check. Amy, am I talking too loudly? Loudly, too fast? No, okay. So, what are multiple mini interviews? So I apologize to those of you on the call who already know what they are. But I'm just going to give a brief overview in case nobody does, because it really is the foundation of the work that I've done. So multiple mini interviews were born out of admissions to medicine, and they were designed to reduce unintended bias. through, rather than having a panel interview where you might have 1 or 2 people interviewing you, there are a series of mini interviews, a bit like speed dating for interview, where you meet 6 or 7 interviewers in a timed circuit lasting 4 or 5 minutes with a different interviewer, so that you get multiple mini insights into someone's personality, values and attributes. Can candidates respond to scenario-based questions designed to assess specific personal attributes and values? And the aim is to objectify selection processes, which are inherently subjective, and to reduce unintended bias. We also want to balance the gender bias towards females, because we know there's historically an issue there, and standardise assessments. So with multiple mini interviews, every applicant gets very similar experience, rather than in a traditional panel interview or a group interview, where you might recruit for likeness or go slightly off and have a chat about something with commonality that you have, which means that the next applicant wouldn't necessarily have the same interview experience. Why MMI is really important? So they were born out of University of Calgary. A guy called Kevin Eva conceived them in 2004. There's over 150 studies published evaluating their reliability and predictive validity, showing, and they show high scores, so their ability to identify those most likely to go on to excel in the profession. And as I said, I think I'm the only person actually who has a PhD in MMIs for my sins. And there's also data looking at acceptability from interviewer and candidates' perspectives, which is all good. And we can enable some psychological safety, which is really important, and social justice, which means that applicants feel that they've had a fair interview and those processes have been transparent and defensible. So there's a strong evidence base around MMIs, which is really important. And obviously I've got a PhD in them. So what I wanted to do was to see if we can ensure equitable access to healthcare, education and employment, so that the workforce, as I mentioned, represents the diversity of the community that it serves. We know internationally that that's not the case currently for the neurodivergent community, who comprise 15 to 20% of the population. And we know, for example, 80% of autistic people are unemployed. So by neurodivergent, I mean people who have got dyslexia or dyspraxia, autism, ADHD, for example. So that was one of my missions. So how was I going to achieve that? So we built the first asynchronous multiple mini interview platform. So I've mentioned the multiple mini interview, the principles behind it. I wanted to see if we could build an online version. And what that would do in the theory was that it would reduce cost of travel, people needing dress code. They could have the psychological safety of taking the interview in their own space, and that might open up the applicant funnel and give people a fairer chance. And we also looked at how we could build fairness in from the ground up through language. So we did a literature review looking at inclusive language and how we could make the whole experience of the interview more accessible and fair in terms of language. And so the first version of this platform, Sammi, which I said stands for Scalable Automated Multiple Mini Interview, was launched in October 21. And we've done over 10,000 interviews to date. I think we've probably done 12,000 now. And people are using internationally, from Canada to Australia, Malaysia, and obviously the UK, in admissions to medicine, nursing, midwifery, and allied health professions, and the UK National Health Service. So that my background is a PhD in MMIs. The whole thing is about building fairness in, rather than taking bias out. Retrospectively, we build fairness in from the ground up, and we've built this online platform. And I've mentioned asynchronous there. That's really important. And this is an overview of what Sammi, how it works. And when I say asynchronous, that's because candidates, if you look on the left side, candidates access pre-recorded videos from the organisation who are recruiting, and they log in wherever is convenient within a certain time frame to answer those questions, and their answers are recorded and uploaded onto the platform, and then the markers go in at a later date and score when it's convenient for them. So what that does is it creates more of a level playing field, because we all know that sometimes there's Wi-Fi poverty. It might be that if you're having an interview online and it was on Zoom like this, for example, and you had a Wi-Fi dropout, it's incredibly stressful. Also, sometimes applicants don't show up. So the whole point about this is they can choose when they want to do it within a time period. Usually it's within a week. And that, again, promotes more fairness. And the other thing that's really important about the pre-recorded videos is that applicants get exactly the same interview moment. Because even if interviewers are trained in a live interview, just the way they ask the question or their intonation creates a different moment with the applicant. And that might be different from some to others and potentially cause unfairness issues. Whereas the pre-recorded videos, when they're played, each applicant gets exactly the same interview moment. So that's really important. So that's Sammi. I hope I've explained it well enough. I'm really happy to take any questions later. There's no point building it, right, if it's not going to achieve what we wanted it to. So super keen to establish that. And there's a QR code there too. This is a paper published in BMJ Open. But we wanted to look at reliability, acceptability, because there was no point building it if candidates hated it or interviewers and admission staff didn't like it, then we were doing something wrong. So we're looking at reliability, acceptability and fairness of the platform Sammi in admissions to undergraduate health professions. So I've got data now on about 4,000 applicants, but for this particular publication, we analysed data on 712 applicants, and they all underwent the interview process between November 21 and May 2022. And applicants were asked to complete an evaluation after they'd received their offer. So of course, their view on it might have been affected by whether they were offered a place, right? But we couldn't do anything about that. That was what the university wanted us to do. And then staff who would have normally interviewed, who completed the assessment of the recorded videos, did their own evaluations. And we looked at reliability coefficients, internal consistency, scale dimensionality, parallel analysis, confirmatory factor analysis, and then descriptive statistics as well. So there's a lot of data there, and I don't have time to present it all, but it is in that paper if you wanted to look it up. But just as an overview, some high-level data. We had a 20% response rate. As you'd expect, well, certainly in the UK, most of our applicants were under 20 years old. Most identified as female, because these were nursing and midwifery and allied health professions. And this was the profile in terms of global majority or white British applicants. But what was very exciting was our comeback. So our internal consistency was good to excellent across all the interview scores. And the interstation correlations were low. And we wanted that because that inferred that each of the questions was assessing a different construct. But then we were interested in subgroups. So we wanted to know, were people of an older demographic negatively affected by using tech? Was there a difference in gender? Or people who self-identified with a disability? And I know this isn't good, but we had to collapse the data to UK, non-UK, because that was the only way that the university central admission system in the UK, how they process the data. So I apologise for that. But what's very exciting is the fact that we showed that Combax was equally as good across subgroups, right? So that the building of the fairness in, the language that we'd used, and what was really important, and I haven't mentioned it, is that we built a practice portal. So applicants could go in and practice as many times as they like before they actually took the interview. And what that did was it promoted psychological safety, and it enabled them to familiarize themselves with the platform so that their performance wasn't impacted by a new piece of technology. And we think that's why the age results that we had transpired, because in fact, the older demographic did slightly better for their mean scores. And I think it was because they were able to practice and just get familiar with the platform. So there's lots of exciting data in relation to that, but I haven't got time to tell you it all now, unfortunately. What did candidates think? Well, pretty much all of them hadn't done anything like this before. That's what you might expect. 89% found the instructions helpful. Interestingly, 78% didn't encounter technical issues, and if they did, they were easy to resolve because we had a time frame within which to do that. And what was fascinating, and I wasn't expecting it, was that 69% were accepting or very accepting of online interviews. And of the interviewers that we asked, none of them had done anything like it before. Amazingly enough, they all found the system intuitive. It's very simple if you're a marker, very simple. But 74% were accepting or very accepting of using Sammi in the future, which was a big turnaround because a lot of interviewers had said to us, well, how can we assess communication? You know, can we assess this and that, excuse me, in an asynchronous format? But then they loved it because they loved the flexibility and the fact that it reduced pressure. And then I was very interested. We're in health professions, communication is so critical, right? So can you assess communication in this kind of modality? So we asked the interviewers, and only 16% said they didn't feel it could be assessed, which again was really interesting. And then what was really exciting was we did an independent evaluation, and we found that it saved 50% of administrative time. And the reason being that applicants could log in whenever and wherever they wanted to, and you don't need a coordinator to set that up. Once they've got their link, they're good to go. So that's very exciting, and that's really helped with adoption. So we had that exciting data, and I wanted to do better because of the neurodivergent population. So we talked about 15% of people being affected, but we know that many thousands are undiagnosed or borderline. And I wanted people to go onto this platform and not have to self-identify as being neurodivergent. I wanted them to go on, and I wanted to normalize differences so that if they went on, they could choose how to customize their setup so that they have that psychological safety and they felt better able to be themselves without having to. The whole word disclosure has negative sort of connotations, and I felt I didn't want that. And so I took the principles from teaching, which is the universal design approach, which means that actually accessibility options should be available to everybody all the time. And that's how we wanted to build this. So the Genius Project was born, if you like. And my whole thing was ensuring people's everyday needs are met. I didn't want it to be what we say in the UK, icing on the cake, or like a luxury, an extra, that we were enabling accessibility. I wanted it to be there for everybody. So what did we do? So our aim was to build an online interview with optimized accessibility, informed by the principles of universal design for learning, meaning to be usable by all people to the greatest extent possible. Now that was I only had a year to do this and a small grant, so that was quite a big aim. So what we did was the best that we could. And we had 2 phases. But what we did was we wanted to augment the pre-existing Sammi. So we did a pilot randomized control trial. I don't think you'll find any other randomized control trial in recruitment for health professions. That's very exciting. And the aim was with that was to explore the impact of the practice portal and inclusive language, because we thought it helped, but we didn't know if it would do. So, and we did this with neurotypical people to start with, because we wanted a baseline, we wanted a ground truth. So we got some volunteers to take one version of Sammi with a practice portal and inclusive language, and then a randomly assigned matched group with a stripped back version of Sammi without the practice and inclusive language. And we looked at differential attainment. And then we did a process evaluation. So what we wanted to do was find out what neurodivergent people thought would enable them to be their best selves. So we asked them to take the version of Sammi that existed and then to take it apart and say, right, what can we do better? What optimizations can we build in to make this better for you? And we brought all that data together. We had nearly 1,000 comments and things to go through. So we prioritized the features and we built them in, and then we reevaluated it with a further 100 neurodivergent volunteers to see if we'd done a good job. At the end of the day, that's all that mattered. So we used t-test to analyze differences in interview scores, as you might expect, and then descriptive stats on the evaluation data. So in the randomized control trials that we did between those two, so they were neurotypical, one with the version of Sammi that had no practice and no inclusive language compared to that version of Sammi that had all those optimizations that we built in. We wanted to look at mean scores, and we found statistically significant differences between the two. And the neurotypical volunteers who had access to the practice portal and the inclusive language were significantly more likely to do better, which is really interesting. In phase 2, when we asked neurodivergent volunteers what they wanted, these are the top features. They wanted to choose their color and contrast. They wanted real-time subtitles. They wanted to choose the font, how the video, how they saw themselves on the screen, and how the progress was illustrated. And we also wanted to look at differences in interview scores between neurodivergent and neurotypical volunteers, because that was the end game. We wanted to build a platform where neurodivergent individuals were not disadvantaged and actually were able to perform similarly to a neurotypical person. So we built this toolbar, and we don't call it accessibility toolbar. It's a tab, a little tab on the platform that says personalize my settings, so that that person doesn't feel like they have to self-identify as being neurodivergent or anything. They can just go in and have a look and customize their setup. So I've got some slides to show you what that looks like. So on the slide now, this is what it looks like. This is the platform. So if any of you on the call were interviewing me, that would be me on the left-hand side. And on the right-hand side is the video and the instructions. And if you look at where it says begin microphone test, if I just move it, you can see it's changed, the font's changed to dyslexic font. So whichever font you choose from the list, the text will change throughout. So you can choose which font that you would like. And then similarly for color. So this is a pale yellow background. Obviously our branded colors are the blue. They might not suit somebody. So you can choose the different color and the contrast from those options at the top. So there's white on black, black on white, and then there's a purpley blue color as well. And these are colors that the neurodivergent community said they wanted. These were the top choices. And then neurodivergent volunteers said to us, they didn't like looking at themselves. They didn't like, so where the setup is normally like this with your video feed taking up half the screen, they found that quite intimidating and intense. And so the compromise was we needed to keep seeing them so they were in frame, so they can minimize their video container. So you can see it's minimized down in the bottom left. And that was to enable them to feel that, take that pressure off. And they also wanted to have the option for a blurred background. That was really important to them. So that's the option there as well. I've mentioned real-time subtitles. That was really important. So on the right-hand side, that would be the pre-recorded video by somebody with real-time subtitles coming up. And then you can see the green strip along the bottom. This is a multiple mini interview online. And I mentioned that it's a timed process. And that timed countdown was stressful for neurodivergent people. They found the countdown pressurizing. So the compromise is that you can count up. So you can flip the countdown to count up. And that made a huge difference to how they perceived the whole process. So it was really exciting. So that's a summary of the features. There are others, but that's just a summary because I'm conscious of the time that we've got. But like I said, we needed to evaluate it. So we asked volunteers what they thought. And this is some of the data that we've got. So this is very exciting. 92% felt the practice and optimizations made it easier to complete the interview. 67% felt less anxious, which is huge, because obviously if you've got that psychological safety, you're more likely to do better. 69% felt less anxious than doing face-to-face interviews. And I think that was to do with being in a different space. So they were unable to be in their own space at home. And 70% felt the interviews were fairer and more objective. So these preliminary findings suggest that the co-design platform was highly acceptable to neurodivergent applicants, and the opportunity to practice should be built in. And what I wanted to do, this is a login page, just show you quickly if, of course, assessors might be neurodivergent, right? So this screen here shows you the marking side. So that on the left-hand side, it's blurred out because it's a video, but that would be the applicant's video. On the right-hand side would be the criteria against which they're assessed. But markers might be neurodivergent. So you can change the color and the font similarly to the candidate side so that we're accommodating the needs for both applicants and interviewers in terms of the neurodivergent population. So there we go. What are the take-home messages? So we found 92% of neurodivergent people felt the accessibility optimizations helped. It was really exciting to hear. So technology is available to level the playing field for applicants, right? And it's not just about, saving time. Everybody's interested in time and money. Yes, you can save the time, but it's about fairness. And even giving the opportunity to practice made a huge difference. So that's really exciting. And this is my whole thing. And I mentioned earlier on about leveling the playing field. But accessibility optimization shouldn't be the icing on the cake, but integral to all selection processes for health professions. And what I found is that there are many low cost but high impact interventions that can happen, that can make such a difference. And if we contextualize that in the fact that we have so many undiagnosed and borderline neurodivergent people, or just people with preferences, that we can make a difference just in these fairly small ways. So thank you for listening. If you want any more information, there's my email address at the bottom, a.callwood@surrey.ac.uk. And there was a link to the publication there on the QR code, which I'm happy to bring up again if anybody wants it. We're just writing another paper where we're going to detail the Genius project. So all the details of that will be available online. And there's a huge amount of data, but so I've just shown the high level stuff. But I really hope that that's interesting, and welcome any questions. Thank you for listening.
Thank you so much, Dr. Callwood. That was fascinating. I will turn off the recording so we can have our Q&A afterwards. So just want to let everybody know that you can stay tuned for more Docs with Disabilities content. Our next Dream Theories talk is with Mai-Tien Nguyen, and that will be medical student burnout by race, ethnicity, and multiple disability status. So that will be December 12th at noon Eastern Standard Time, or daylight. I don't remember which one we're in anymore. Daylight, I believe. Anyway, you can register and learn more about the Docs with Disability initiative at DocsWithDisabilities.org. Thank you. All right.